Dr. Carly Mayer. I am CCR's medical director, and we are here in Warrenton to scope for strangles. We are here to test this group of mules for strangles. We are scoping their guttural pouches and flushing them with saline, and they send that off to the lab to look for pieces of DNA that indicate if there are strangles organisms in their system. And we start with this one test, and then we'll repeat it with a flush in a couple weeks. And we do 3 of them total to make sure these guys are absolutely negative for strangles, because it's very contagious. So if you are part of a rescue or want to adopt from a rescue, please make sure they are testing for strangles to prevent the spread of this organism. The mortality isn't very high, but they do get very sick, and a lot of them get very sick if it gets spread around. So that's why we're here. And all right, so I am passing this video scope up through the left nostril, trying to navigate to the back of the throat, avoiding any structures that are in my way, such as the ethmoids, which are what make them bleed when you stick things up their nose. All right, so I'm in the back of the throat looking at the oropharynx. And if you look and see those 2 little gills on each side, of the stomach, those are the openings to the guttural pouch. So what you have to do is use a wire you just saw come out there on the screen to guide yourself into one of these pouches. So the wire goes in between the opening of the guttural pouch, and then the scope rotates, and then you're in. So then you pull the wire back so it's out of your way. The inside of one of a guttural pouch, and we look in here for chondroids. Those are little niduses of infection of strangles, and that's how horses are carriers of strangles. So they can be asymptomatic on the outside, but in here they carry little nodules of the strangles bacteria. But his pouches are pretty clear. All the structures you're looking at in here are normal. And he's good to go. All right, so my assistant Emily is going to attach the saline to my scope here. Perfect, thank you. And then go ahead and flip that over. Yep, good job opening that up. And we're gonna pump. It takes a couple 100 mils of saline, because these pouches are so big, to fill them with saline so that it'll come back out the nose so we can catch it for testing. It probably tickles a little bit, but everything we're using is soft, and it's just really gentle saline. And so as you can see, it's coming back out. So she's gonna catch some from each side of the nostril, so we get samples out of both nasal passages. That's perfect. And that's all there is to it. Then we just gently pull the scope out. We are back at the beginning.
That's really easy.
Next one, really easy.